I'm a deep sigh before this one, you guys, because when I think about where we are right now in the pandemic, this is the graph that weighs heavily on my mind every single day. Look at it. It's the CDC's COVID case count. Spans from early 2020 all the way up to this week. But here's what actually keeps me up at night about this graph. Around March and April 2020, you see there on the left side, when the world shut down and people were really scared to leave their homes, the COVID case count was 30,000 a day here in the United States. Fast forward to July 2022, right now, today, as we sit here, and we are over 100,000 new cases of COVID every single day in the United States. And that number is likely a big undercount because of people using at-home tests or people not even testing at all. And it seems like no one is concerned about this but me. Like, I feel like I'm still the only one left participating in the mitigation necessary in this pandemic. Restrictions are gone, mandates are gone, travel is back to pre-pandemic levels. And it seems like everyone else but me has decided that COVID is over. Well, the virus clearly has other plans. And joining me now, okay, maybe the one other person, me, you, and my dad, who does not believe the pandemic is over, Dr. Uche Blackstock. She's the CEO and founder of Advancing Health Equity, and also she's an MSNBC medical contributor. So we're talking about BA.5. That is the new variant name that we have to know. It's now dominant in the United States. I mean, how do we get to this point, Dr. Blackstock? And how does this variant impact reinfection? I mean, I feel like people who got Omicron, they're out here without masks thinking they're fine. And I don't know that that's true.
Zerlina, I know, and I feel like it's deja vu. I feel like, every few months we're having this very similar conversation, and there's a new variant. And what I will say is people need to understand that BA.5 is probably the worst variant that we've seen because not only is it more contagious, but it's also able to evade immunity. So immunity if you've had a prior infection, or immunity even if you're vaxxed and boosted. And so, and as you mentioned, we probably have over 1 million cases right now. We are undercounting, but we think it's by a magnitude of 10 or 15. So we're having a lot of cases, and it's because of BA.5 combined with the fact that we've lifted all of these COVID protections. So it's not a surprise. And we're seeing an increase in hospitalizations, which is also very concerning. But one thing that's often not talked about is the risk of long COVID with these infections and reinfections that we're seeing with BA.5.
So this is a really, really important point that I want everybody at home, especially the folks who have already had COVID, I want you to listen to the answer to this next question. So if you've had COVID already, I understand if you're a little bit less scared than I am, me who hasn't had COVID at all, to go out here and live your life, even without a mask. But can you unpack for those folks the risks of long-term side effects and long COVID with repeated reinfections of this virus?
I know, and that's something that is, I think, not often discussed enough. I mean, even when we hear communication from the White House, we hear very, very little about long COVID. But the fact is that every time that you get infected, that substantially increases your risk for developing long COVID. We know that people, about 15 to 30% of people will develop long COVID symptoms after an infection. So think about every time you're infected, that percentage increases. And so, this is something that definitely needs more attention. I know there are a lot of people in the disability community have been mentioning this since the beginning of the pandemic, but we are essentially seeing a mass disabling event right now, and it is getting worse. So that is why we still do need those measures in place to decrease transmission. So it's not enough to be vaxxed and boosted. Right now, we have variants that are causing what we used to call breakthrough infections. People are still getting infected. And so that's why the masking is still important. That's why it's still important for people to be tested. That's why we still need to think about what's going on indoors and air filtration and ventilation. That infrastructure issue is an issue that has not gotten enough attention, and that we really need federal support for businesses and buildings to implement those measures.
So how do you recommend people navigate the next couple of weeks? I mean, we're just coming off the July 4th holiday. I've learned enough in this pandemic to know that after a holiday weekend or a holiday, we have a surge of cases because of people are traveling and gathering. How would you recommend people navigate the next couple of weeks? Put your mask back on?
Yes, and this is the thing. Like, it's what we've always been saying. And I think what happened is people thought once those restrictions were lifted, it meant like, okay, yeah, we're going back to normal. But we are never going back to that normal, unfortunately, not anytime soon. And so we need to educate the public that things are going to change. There are going to be waves, and there are going to be times when you are at high risk. And so, especially when you're in indoor crowded areas, you have to mask up. Also, if you are having symptoms and testing negative on those rapid tests, you should isolate yourself, because what we're seeing with BA.5 is that people are testing negative very, very early in the course. There's nothing wrong with the tests themselves. It's just we're seeing a characteristic of BA.5. And so masking, testing, if you're symptomatic, staying home, getting vaccine boosted, all of that is very important. And I think even outdoors, people have to be careful, because we're seeing with BA.5 that it's still, because it's so highly contagious, even outdoor crowded areas are places that people need to be very, very careful around.
It's fine to adjust some of these rules that we assumed were all just like true and gospel from the beginning. I mean, you know, the outdoors versus indoors. I always was like, I don't think they meant outdoors, but next to 100 people standing together with no masks. I don't think that's what they meant when they said outside versus inside, you know. Anyway, Dr. Blackstock, thank you for making me feel sane. I appreciate it. You and I were the last two people left in the pandemic, or at least following the mitigation seriously. Thanks again. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.